Yes, Michelle, good evening. It's a pretty similar picture actually across all the four nations, but focusing specifically on England. What we've seen with the kind of the Omicron variant coming on board over the last month or so, and we had those early signs from South Africa, it was less deadly. It's quite clearly borne out in the facts and figures. We've got the lowest number of patients in intensive care now in England since we've seen in July. And because Omicron's so transmissible, we do also see quite a high number of people who are in kind of hospital who are in with COVID, but not specifically for COVID. So the situation overall in the hospitals has improved quite a lot over the last kind of month or so, and it's definitely coming through as a less deadly.
And Jamie, people watching this will say, well, hold on a second, this is about patient safety. So when it comes to transmission, if somebody is unvaccinated or not fully vaccinated, there will be the argument that those people are more likely to transmit COVID. What are the statistics around that?
Yeah, so the ONS kind of do a survey, an infection survey, and they look at the kind of the relative risk of catching COVID, and they've compared two groups. So they've looked at the people who've had vaccines versus those who haven't had a vaccine, and another group who are people who've had a prior and those who've never had COVID. And what we see is that you are reduced chance of catching COVID if you've had a triple dose, about 40% chance, less chance of testing positive if you've had 3 doses of the vaccine versus somebody who's unvaccinated. But that's not the full story. If you actually look at people who've had COVID and those who've never had COVID, there's a 60% reduction in the chance of catching kind of COVID or testing positive for it. So, many healthcare workers would be in the category, they've been on the front line. Loads of them would have caught the virus. So it's not as simple as just saying a healthcare worker is unvaccinated, so they're more likely to kind of catch it. You've also got to consider the fact that many of them would have already had COVID, and that does offer some protection as well.
And Jamie, if you will, just talk to us as well about the picture of the kind of the backlogs, the waiting time, etc.
Yeah, so Michelle, I think you mentioned we've got like 6 million patients now on waiting lists. Now that's probably going to continue to rise because we still know there's been a huge number of people who've got misdiagnoses over the last kind of year or so. So that's probably going to rise. We've got 40,000 vacancies for nurses in the NHS. So we've got vacancies to fill rather than obviously losing staff. And sadly, we might start seeing people lose their lives if they can't get the care over the next few years because of all the misdiagnoses. I think a pertinent factor, Michelle, probably for your debate on the show is that the flu vaccine, we know last winter around 30% of frontline NHS staff didn't have the flu vaccine, and that's gone on for several years. And we know the flu vaccine, offers some protection for those who are vulnerable, but we've never had a mandate to kind of vaccinate for the kind of the NHS staff as well. So I think that's a pertinent fact when you're considering the debate around should you be vaccinating staff or sacking them.
Jamie Jenkins, thank you very much for your insights.